Let's go see what Dr. Seth has to say from Limitless Physical Therapy about some tendinosis, all right? We'll talk about some tendinosis, what it is, some things you can do, because I'm curious, because I'm trying to sprint, but obviously every time I'm sprint, I have some Achilles soreness, stiffness, I should say, not much soreness, it feels stiff. Anyways, we're gonna go see what he has to say, and keep you guys posted, so smash that like. All right, we're here. The Limitless Physical Therapy. Seth's a great guy, so make sure you go check out his information down below. I don't know if he has his beard anymore, but his whole thing is limitless, right? Check this out, he's a dude. Limitless Physio, check him out. So what I believe, I have some tendinosis versus tendinitis, and he can talk to us about the difference. All right, I guess we're waiting for him, but check out this dude. Look at that beard. Look at that beard. Wish I could do that. Let's check out his office. Let's go through his stuff. Alright, $100 if you can guess Seth's middle name. Starts with an F. A real doctor. Learning doctor. Alright, so we finally found Dr. Seth King over here, Limitless Physio. So
found me.
Again, what's the name? I just want to make sure I got it right.
Limitless Physical Therapy and Performance.
Okay.
Limitless.physio is the website.
Limitless.physio is the actual website that'll be linked up down below. But anyways, like we're talking, he was just asking me some questions. So we're here for some tendinosis, I believe, versus tendinitis. So we can talk about the differences between the two.
You certainly will.
I've been doing some tendon research. The tendon, we'll just talk. We'll just talk it through.
Let's do it.
So anyways, so the tendon pain has been a little bit more like in the insertion, right? So down at the bottom of my heel. So I believe that's another reason it's tendinosis versus tendinitis. And so what tendinosis is, maybe you can tell them what it is. I think it's like more of a degeneration of the tendon, but you probably know a little bit more than I do. So if you want to share anything.
Dude, for sure. So first of all, can have tendinitis in other areas though.
Mm-hmm.
You can have insertional, mid-substance, or at the myotendinous junction, which is basically where the tendon kind of forms right into the calf muscle. So you can have tendinitis in other areas. If it's been going on for a while though, the reality is it's probably not itis. Itis always refers to inflammation. Yeah. If it's not puffy and red and really, really irritable, chances are it's just kind of progressed into more of a like a tendon degeneration. Yeah. A lot of the research we have on this stuff basically tells us blood flow changes, some of the actual fibers in that area can be frayed, if you want to say it that way.
Which freaks you out.
Well, yeah. I always
hearing degeneration of a tendon, I'm like, no, that just sounds terrible.
It's actually not even helpful to use those words most of the time with people because they freak out about that. Right? You get like an MRI on your ankle, and you'll read horrifying things about it that all mean normal things. Right? Because we all have degenerative changes. That's part of the aging process. For me, it is. For me, it is at least. But no, the reality is, man. I like to kind of refer to it like corrosion, right? Like something, if it's not addressed, if you've had a little bit of tissue breakdown, you've kind of experienced a little bit of corrosion in that area. Not that you're made of metal, although you are kind of an Iron Man, aren't you?
Yeah, I try to.
So like
lift iron.
You lift iron, that's right. I think we know that there's some circulation changes. We know that there's tissue breakdown. I think the underlying principle behind some of the rehab on areas like this in a tendon anywhere in the body is you most likely have lost, the whole tissue capacity after you've come upon tissue capacity in some of your research.
Yeah, all things I don't want to hear, but yeah.
Well, I mean, all things you know already, though. Let's be honest here. Your tendon is not able to handle the level of stress
that was putting into it.
Yeah. And so it's kind of a protective mechanism to some degree, where our alarm systems go off. We have pain. Our body kind of it mobilizes to that area, and that's what I think a lot of times we get stiffness because our body's trying to protect the area. Yeah. And that's actually, I mean, if you think about it, especially like middle-aged guys, a lot of guys that come in here are always worried about like, hey, does this mean my Achilles is going to rupture and snap? Yeah. No, it doesn't necessarily mean that, not at all. But our body's really good at giving us warning signs and alarm systems that something needs to be done. And a lot of times stiffness and pain tells us, hey, maybe let's not move it as much. Maybe let's be a little careful on this for a time.
So that's exactly why I called you, honestly, because I was getting out of bed and I just felt like stiffness, like right in here, right?
First thing in the morning.
And so yeah, like even when I sit up in the middle of the day, like it'd just be some stiffness going on, and I know it's obviously not normal, and I actually never had this before. So maybe it was the hill sprints because you're on the incline, and like obviously you're doing sprinting, which is like one of the most forceful things you can do. So obviously it's a lot of force through that tendon. So that's the only thing that's honestly been different is doing the hill sprints, because I never actually had this before. So that's why I was like, I don't want Achilles rupture because that sounds terrible. And so anyways, that's why we're here talking about what we can do for this thingy down here.
I think the key word you said there too is different, right?
Yeah.
Like the majority of times, I would say 95% of the time, the thing that causes it is the thing that's different. Your body didn't have a chance to adapt somehow to some new stimulus. It's hill sprints for sure, man. I mean, that hiking longer distances, there's a lot of different potential causes for this kind of thing for sure. The most important thing is really looking backwards in your training history and seeing, like, first of all, am I tracking things well? And objectively, are there week over week differences in total work volume, some of the dynamics of your training for you, elevation, incline. That's something you probably normally do a lot of, though, isn't it?
Well, we do some, like, I haven't been sprinting consistently, and then I kind of went to sprinting, but thinking you'll just pick up into it.
Right.
And the hill is a little bit longer too, it's like 40 yards. I do sprinting, but I haven't been doing hill sprinting, which is also like you're saying, you got to ramp up into your training program. And also, have a good progression so that way you don't overload stuff.
And let's be honest, there's a little bit of chance involved, right? Because a lot of times people can jump into those things and not have any.
All right, so how long ago did this happen? So this was maybe, we'll say a month ago, about 4 weeks. And again, I was doing hill sprints maybe once to twice a week, and typically the feeling of stiffness in my Achilles would go down as I warmed up, right? So as I was going, getting blood flow, increasing circulation. It was feeling better, feeling fine, but the next morning, I'd still feel that stiffness back again, and it's just something, like I was saying, it's not something I haven't felt before. It just felt stiff and tighter than it used to be. So of course you can foam roll, massage your calves, stuff like that, but it was just like more so in the insertion point. So in case people don't know what insertion means, right? We're talking like kind of where your Achilles runs and kind of inserts onto your heel, right? Attaches down here in your calcaneus. But anyways, had some stiffness kind of specifically in that area as opposed to in the actual like belly of the tendon, if that makes sense.
Yeah, no, a lot of other questions.
Okay,
so
let's go.
I think it's like, let's take a look at then what are consistent aggravating factors right now, things that are reliably irritating.
So stuff that's reliably irritating it is really nothing, because I haven't been like sprinting or anything like that. So like I was trying to be smart of like, okay, this has been aggravating it, high speed, high force, I don't want to incur an actual injury, so I've been doing things to work around it, right? So I haven't been like doing rapid loading of like jumping or skipping or running. I haven't been doing any of that, just been basically lifting. And like I was saying, just feels stiff, like even just walking around, getting out of the car, like I was saying, just feels stiff and something that's not normal.
Perfect. Anything make it feel really good?
Nothing that makes it feel good. I mean, I always try to stretch it, like just kind of like push my heel through just to try to stretch it and elongate it. Obviously rolling it, massaging it, foam rolling and stuff like that.
And I don't know, I feel like maybe we've talked about this in the past at some point, but one of the first things that I always tell people, especially with Achilles, is probably stay away from stretching your Achilles tendon. The reason is 9 times out of 10, the injury actually happens from an overstretching event. And so if we're trying to lengthen the tissue and the problem that is irritating the tendon is not a lengthening issue, then we're not really contributing to it. In fact, we're probably just tugging on an area that, think of like a knuckle, a scab on your knuckle that you just kind of keep doing that with. It's probably going to delay things a little bit. Right? Same thing with ice, non-steroidal anti-inflammatories, things like that are really helpful in the first few days after when it's really painful or if it's really irritated. But in the stage that you're in right now, it'd be better to stay away from that stuff and probably not to stretch it excessively. We'll talk about other things that are better to do with stretching.
All right, so potentially, again, we'll let you talk to that, but probably more like massage, actually soft tissue work to get in there and break things up versus like you're saying, another good analogy I've heard before is like if we had these resistance bands right there, right? Like if we tie, like if we have like one of those big thick green ones versus like a skinny orange one, right? If we pull those two apart, the big one's not going to move, right? It's like the little one's going to move, which could be like the muscle versus the tendon, right?
Yeah, that's exactly right.
So there's no point in stretching it, like we're saying. So we got to get in there and get some manual work.
Yep. That's right. So I think the best way to manage this, like right off the bat, is number one, put out the fire, right? Like the pain that you're having, some of the sensitivity, if you want to call it that. Manual therapy, different things I do. I think we'll start with Graston just because it's just helpful for that area. Not necessarily super comfortable, but helpful for some of the microcirculation, especially. But put out the fire, right? Calm the symptoms down. Then have some longer term strategies to actually improve the problem, which is how much can your tendon actually handle. So you better believe strength training and specifically heavy, slow resistance stuff is going to be kind of the main focus.
Yeah, so a lot of eccentrics, probably like slow.
Eccentrics, isometrics, really slow tempo work is always kind of the best place to start.
Cool. So,
shall we?
Now we're going to do some Graston?
Yeah.
All right, well, you heard him. Do some Graston. See what we got.
You should look at how your feet actually interact with your feet.
I do have pretty flat, overly pronated feet.
So yeah, if you just stand normally, and I even just kind of reset, like do a little shifting back and forth, and then just yeah. So, and I would even say, I mean, it's notably even different between left and right. Does it look that way to you, looking down?
I mean, yeah, look at a little bit more of an arch, and this one looks a little bit more collapsed. Like it could be, for like your talus, you know what I mean?
Yeah.
Might be stiff in there.
Yeah, it could be. So there's, that for sure to take a look at. The main thing I wanted you to do is try to lift your toe up towards the ceiling. Does that cause any of the pain in your heel? No. If I give it a little bit of overpressure, does that do anything?
No.
Just like a little stretch.
Yeah,
mild
stretch under the toe, nothing in the...
Right. I think it's hard, it's hard to objectively measure what we're talking about here, which is essentially midfoot pronation is what we would call that, where the inner portion of the arch, kind of the middle portion, is definitely closer to the ground than we have over on the right side. And you and I were talking that could be compensatory, like that may have changed since your Achilles got irritated, or it could have been there the whole time.
I think I've noticed like that, like that collapse, and I actually do feel a lot of stiffness more in my left ankle personally.
Do you?
So, I mean,
naturally,
I do notice it when I squat and stuff
Yeah.
like that. So, I do feel like, I don't have as good, could be like in the ankle mobility.
Yep. Let's just take a look at something then. So stay in your bare feet.
Okay.
Good. Let's just take a look at like kneeling dorsiflexion, just to get a little bit of a look if there's any huge like gaping asymmetries. Put your fist down against the wall.
Yeah.
Big toe up to fist. Try to keep that heel locked down and go. Make sure you're going over the middle portion of the foot. Heel stays glued. So this is sort of like a pass-fail test.
Yeah.
Not to say that you're like a failure or anything, but you're definitely we should, to express the full amount of ankle motion that we need for a lot of things, should be able to touch the, whatever that's called, the wall. Try it on your right side. I think it's most notable when there's a big difference though between sides like we have right there.
It's almost similar.
Is it?
Yeah, because if I go forward, I might be able to get more.
You can put more pressure through there. Now where do you feel it at? You feel it in similar areas back there?
I feel a little tightness in the front and then like some stretch.
Fair enough. So a couple different things, like just easy rule of thumb for that test. No, quite a few people, myself included though, when I do this test, I'm on my right ankle, I'm a little bit blocked compared to my left, and I feel it in the front of my ankle.
Yeah,
like right in this little crease, and that's usually more of the talocrural, like ankle stiffness, right? Mm-hmm. You're feeling it on both sides, more in the Achilles calf region. But that just tells us kind of the main restriction that's probably holding that motion back.
Yeah.
More so than ankle joint. Not to say you shouldn't work an ankle joint, but yeah, for sure. All right, so let's also, this actually be super interesting. Why don't you face the camera and show us like an air squat in bare feet? Just to kind of express that pronation in the foot again.
All right.
Just normal squat stance, however you normally would.
I'll probably squat wider because I feel like my hips are tight, but
that's fine.
Slow. So I feel tight like just in the front when I squat, and it kind of kicks me forward.
Yeah, so I mean, you really slow that down. You can even see that left heel really wants to spin inwards at the bottom.
I think that's the hip stuff.
Yeah, I mean, of course, it could absolutely be from many other regions in the body, but all of this plays some sort of a role, right? So it's just important to do something about all of it, right? All right. So can you walk back and forth a little bit? I know that's not a huge space, but walk to the chair and then back. All right, hold on. There's no way that wasn't normal though, right?
That was normal.
Was it?
Yeah.
Okay. Come on back. Let's
forward.
I think when you play this back and take a look at your right side, you're going to see some interesting stuff.
I mean, yeah, plus you can even see, like, I've noticed a lot in the wear of my shoes, like, I do feel like there's, like, a little bit of, definitely, like, almost like a little length type of feeling discrepancy.
Yeah, potentially. Potentially that. There's a lot of things.
Yeah.
You could just have some genetic factors at play, too. You're definitely not someone who struggles to, like, your knees don't wink in very much. When you're walking, your knees are away from each other, right? You're not bow-legged necessarily.
I'm saying I'm bow-legged.
Well, your right side, though. Your right side, for sure. Like, you supinate way out like that, even on the outside of your shoe. Like, is the wear pattern that way?
Yeah, so we were talking about that too. These are pretty old shoes, but like from the heel, this is the right. You can see I got way more medial. So this is the right.
Mm-hmm.
And you can see like just like the difference in the heel. Like there's so much more meat in the middle.
No doubt about it. Yeah.
As opposed to this one, right?
Right.
The wear and tear. There's more, lateral.
You have inserts in here?
No, just normal.
I mean, are there?
Yeah,
these removable.
Oh yeah, I think so.
I'm gonna take that out too. It's always kind of interesting to look at that. It's like how much more torn up is your right side, right?
Mm-hmm.
And I would say you can feel the thinness difference on the outside of that insole. That's a little bit of a better indicator than the bottom of the shoe. Super thin. So it's just, that stuff is amplified over, weeks and months and years of movement, right?
It says it's a little bit uncomfortable, but guess what? It's going to get some blood flow in that area more than anything.
Yeah.
And as he was saying, that blood flow is going to increase circulation and get good nutrients there. So what are some things that...
Nutrients.
Blood nutrients in your tendons.
Yes, sir.
So we'll go back, past the camera, back and forth.
We'll pass it.
What kind of tools are we going to be using this thing?
Yes, sir. So this is called the Edge Mobility Tool. I'm certified in Graston Technique. That ultimately is a technique and a proprietary name and brand. So we don't care about buying a $2,000 set of metal tools. We care about applying it the right way. There's a lot of these products that, honestly, I really believe people can learn how to do this stuff on their own. So when we do this, do you have any of these types of products?
Actually,
like
we
Sidekick
did.
or
We did.
something like
I
that?
think we did buy a Sidekick actually, and so it has that same metal type of tool,
Yeah.
but it's all about knowing how you're doing it.
Yeah, so we can talk through kind of the angles and some of that. I think that'll be helpful for you.
Cool.
But no reason you can't do this to yourself even daily, as long as you don't, there's no need for huge amounts of bruising. Some people go really far with the amount of pressure they use, and again, if the purpose and if the research says we're not really breaking stuff up, we're more desensitizing, we're reducing pain, improving circulation, that doesn't require heavy pressure.
Something like I would do a type A person, right? They're the ones that if I don't feel it, then
Dude,
if I can't walk the next day.
I always one of my first patients that I tried Graston on loved the way that it felt on his shoulder. I tell this to so many people, and I give him a hard time about it too. But I tried this on his shoulder. He loved how he felt the way after. It really helped as a part of his plan in PT. He went home and did it with a spoon and came back with this huge abrasion, almost like a sore on his shoulder. So anyways, it's there's definitely merit in learning how to do it the right way, but past that, it's not an overly complicated technique to do on your own.
Awesome. Well, we're going to see you in action.
Yes, sir. So is it actually tender to the touch anywhere?
Oh, that barely just feels like much. Probably if you, more of that.
It's definitely more central.
A little bit more of that, yeah. Nothing up the belly, more so just right.
I'm just kind of getting a sense for how much joint motion do we have with calcaneus, right? And I think right away, and this is not there's no real measurable thing here, but subjectively at least,
I can
lots
feel
of
the
medial
difference.
lateral movement there. If we kind of come in here, lots of medial movement, no lateral movement, right? Which is kind of an interesting, what that means is any of this calcaneal eversion that you're going to get, you're not going to get it there. You're going to get it from the front half of your foot, which is probably why you see the mid and the forefoot a little bit pronated at rest, because they just have had to adapt that way. Now that's calcaneal eversion inversion is kind of a rabbit hole, so we don't need to necessarily go down there. But I do think long term we talk about some ways to work on tibial movement. You've seen some of that stuff
tibial torsion.
Yeah, tibial torsion, blocking talar curl joint. There's a lot of stuff there, but there's always so many rabbit holes you and I can go down.
Yeah, it's always fun with you.
Yeah, I guess first thing, if people, this is not meant to be an instructional video for how to do self myofascial work, but I do think it's always important to use some sort of an emollient or an oil-based lotion of some sort.
Yeah.
No real specific way other than we need to try to make sure that the bevel on the tool is not at a perpendicular angle, but a bit more close to 30-40 degrees. It's really, really aggressive to get right over top of something with a sharp edge and to scrape it back and forth. We want to have a little bit of an angled away from the direction that you're actually moving in, if that makes sense, and that's what we're always trying to do. So if I'm moving up towards your ankle, up towards your calf, I'm always going to keep that angle that way. And I'm not using heavy pressure. I'm not going to lean into this thing at all, especially in the Achilles. I have you in, I know it feels like maybe a stretch position, but it's really just neutral, 0 degrees or so. I'm just using light pressure, pretty fast, working my way up the whole tendon. Here's some of the texture there.
Yeah, it sounds gritty.
Yeah.
Feels gritty
A
too.
little gravel inside your skin, maybe.
It's a good way to describe it, like a dirt road.
Yeah.
It's like a dirt road in your tendon.
For a long time, people used to talk about like that sound being somehow correlated to what the tissue is actually like
Yeah, like
underneath the skin.
representation.
Yeah, like it's a little more disorganized because it's still healing. There's still a lot that we have to learn about that stuff, though. You know, I do Graston to myself actually somewhat frequently, especially during summer times when I'm running a little bit more. Not my Achilles, but my knees, like around my kneecap. I love the way that it feels afterwards.
Oh
sure.
yeah, I've actually so I'm sure it's gonna feel a lot better.
I think that mobility piece that you're talking about, where it feels a little stiff, that changes pretty quickly. But again, like we've talked about in the past, if you make an edit or you change the way that or how much mobility you have, if you don't end up using it, it's kind of like not hitting the save button and you lose that progress, right?
Yeah.
So you gotta always follow this stuff up with something active. You all right?
Yeah.
A little sensitive in that middle area, or not too bad?
Yeah, not so much right there. Like that feels pretty good, but yeah, once you get up there, that just kind of feels nastier.
Yeah. But again, more of the source of your pain was closer down to there, right?
Yeah.
So it looks like I'm scraping in both directions, like I'm doing that. It's really though, it's a press there, and then I'm just kind of letting the tool glide back on its own. You all right?
Yeah.
Kind of left with like a little strip of red. It's not bruising necessarily, but it's definitely some of that microcirculation.
Got to do everything.
That's right. You can see the skin kind of blanching, some of the capillaries on the very top. It's good. Just an excuse to do more Graston on you. It'll definitely feel like a little different temporarily.
Yeah.
So that's your first experience with Graston.
First time.
Not too bad, is it? No. Yeah.
It does feel like you're saying it feels almost not like a sandpaper. It feels like sandpaper inside of something almost.
Yeah.
Like
Yeah. You feel all the tiny little textures of
yeah.
the stuff underlying your skin.
It's kind of gross feeling, but
Yeah. Have you been doing strength work already?
yeah.
So I feel like if you've dove into some of the Achilles research, of course you found eccentrics and some of that stuff, right?
Yeah, isometrics. Yeah.
So what have you been doing? What have you been doing?
All I've been doing right now recently, since I've been feeling that, is just more eccentric based only.
Yeah.
Is just like calf lowering, right? So it's standing on a stair, and then just 5, 4, 3, 2, 1 on the way down. Reset from the top. 5, 4, 3, 2, 1. I haven't been doing any isometrics consistently.
Okay.
Just like kind of the eccentrics.
Again, I would say eccentrics are even maybe like towards the, when it comes to like total stress for your Achilles tendon, that's definitely towards the top of what it can handle.
Yeah.
So I'd almost rather you start with some isometric stuff, or even without the whole deficit under your heel, because you're doing them off of a step or a stair or something. Is that right?
Yeah.
I would say start with the ground and do what I would say. And let's try it now. We might as well try it right now, right? Isometrics would be basically like an actual, like a maximal hold, and what I would recommend is that you actually get your hands on a wall or something. I would stand right next to the wall, like stand tall. Yep. And when I say isometrics, I mean I want you to push through like the front half of your foot as high as you can get your heels, minimal leaning on your hands, and then let off of one of your feet. And if possible, if you can give that like a 5-6 second hold, then lower down just to the ground though, right? So that's a really slow, like one repetition should not be less than 10 seconds, if that makes sense. So you're going both up. So this is an eccentric to some degree, but a lot of eccentrics go, full range, like down past 0. We're gonna just keep that floor as your barrier. Again, to not throw too much stress at it. We want a healthy amount of stress, not an excessive amount of stress. Does that hurt at all, Josh?
No.
No. You can even see kind of the skin blanching there right under the area that we treated, and then that redness returns to normal. It's just showing you you'll see it. What's that?
Do you want this to be the last one?
Yeah, sure. I think you want it to be the last one. I think that's the reality.
I can do that.
As far as volume though, I mean, you can circuit this together.
A couple times a day.
Yeah, I think that'd be good. Think of it as treatment, not necessarily strength training, right?
Yeah.
The other thing then would be really slow tempo calf raises, again, from the ground. 5 seconds up, like 1 second hold, 5 seconds down. So why don't you try that? You might as well do it with both calves. Do a set with like both calves and then try it with just the left side.
That'd be the progression, right?
Yeah. A lot of times with, especially the lowering portion, that eccentric work, by the way, is huge for the stretch cycle that our ankles go through when we're sprinting, right? It's just at a really fast rate. But the lowering portion of this, a lot of times you'll see people, it's almost like a cog and wheel, like it's like a little catchy on the way down rather than smooth.
Oh yeah.
Your goal is to try to make it like a 5 second elevator up, 5 second smooth elevator down. You're doing a good job though. Nice. You want to try it with just one calf?
Sure.
Does it feel okay? I mean, is it irritable at all?
It feels like almost like not a tightness, but like almost just more so when it's like contraction and shortening.
Yeah.
Lengthening it feels better, but more so like when it's like at the maximal kind of contraction.
Okay. Just realize, I think a lot of times when people feel, when pain comes into the picture, especially when there's some sort of, worry kind of in the back of your mind, a lot of times our hesitation in rehab is to kind of back off of that. Most of the research says that pain is a part of growth a lot of times, and that's true in so many areas of life.
Yeah.
Right? Yeah. But no, pain is a part of growth of tendons also, where I usually tell my clients, if it doesn't exceed like a 3 or a 4 out of 10, I know that's a subjective measure, 10 being like you're being mauled by a bear, 0 is like no pain at all, right? If it's not exceeding a 3 or 4 out of 10, you're probably still, you have a green light to continue on. Sharp pain, swelling, things like that are, anything more than that 3 or 4 out of 10, those are maybe more yellow flags that are worth paying attention to. Does that make sense?
Yeah, so a little bit of
don't
pain.
be scared of a little bit of pain here, especially as you're trying to kind of build back up the fibers of the tendon as it's healing.
That's my natural inclination. I think a lot of like athletes or motivated individuals, like they're fine with that. They work with that pain, but also at the same time not pushing it past a certain threshold.
Right.
Obviously, do those calf raises is the first prescription.
Yes, sir.
Do some manual work.
Yeah, some self-manual work if you can.
Just to get blood flow in there.
Yeah. Sometimes people feel, just for daily life, especially active individuals, it might feel good to put some like rock tape or some sort of like therapeutic tape on there. Do you have any any of that at home?
No.
But I mean, it's kind of like a Band-Aid to some degree. I
Yeah.
think just you know what's happened, you know what to do, and you need to now feed it the right amount of stress. And I think it's appropriate to back off of what you've already backed off of, and just to kind of be patient with this thing. Is that fair?
Yeah, 100%. That's great. So thanks to Dr. Seth at Limitless Physio. His stuff's going to be linked up down below. And where can I find you?
www.limitless.physio.
Limitless.physio.
I'm all over Instagram and Facebook too. People want to find me.
Yeah, go like his stuff. Great information. Thank you again.
No problem, man.